Hi, this is Dr. Nina Englander, and I put together this video to give you some background about chiropractic and health, and to help you get the most out of your care in our office. Let's start out by talking about the word healthy. Let's say we go out to dinner and we are served spoiled fish. You feel fine, but I end up throwing up all night. Which one of us is healthy? The healthy response to eating something spoiled is to throw up. It doesn't feel good and you don't exactly feel healthy when you're throwing up, but that's what your body's hardwired to do to protect you. On the other end of the spectrum, we all know people who seemed totally healthy and suddenly wound up in the hospital or diagnosed with a condition out of the blue. So let's talk about health and what health really means. And then we can help ourselves learn about how to regain our health, get better faster, and help ourselves to stay that way. I want to share a story about my own health journey. When I was 19, I had back pain, and I went to a chiropractor for the very first time. I filled out the health history form. It was very long, and ended up writing down that I had had stomach pain after every meal as far back as I could remember, but that it was okay because that was normal for me. When I sat down with the doctor, he assured me that pain after eating is not normal for anyone. I started care for my back pain, but within a month or two of doing the chiropractic care regularly, the stomach pain was gone and it has never come back. Actually, this is what inspired me to become a chiropractor, and I have never regretted it. Since then, I have explored many different paths toward good health, and there are many. But what I've come to understand as the primary foundation of good health in the body is the one specific system of the body. Without that one system in excellent working order, the rest of the body just cannot function optimally. And that system is the nervous system. The nervous system does many, many things, but the most important function of the nervous system is to help our bodies adapt to stress. Here's a good analogy for how our bodies handle stress. Think of yourself as an 8-ounce glass. How much water can fit in an 8-ounce glass? That's right, 8 ounces. What happens if you try to pour 9 ounces of water into an 8-ounce glass? Yep, that's right, it overflows. The stresses that you have in your life are like water. When you accumulate stress, you start to overflow. That's when you get symptoms. Now think of someone who has challenges in their life, a disease or a condition, a disability, emotional challenges like anxiety or depression. That would be like putting a big rock in the glass. That person has even less room in their glass before it overflows. The overflow of stress, or our body's inability to adapt to stress, is what causes many of our society's health problems. The biggest example is cardiovascular disease, which kills over 800,000 people in the U.S. every year. But there are many others. In fact, according to the CDC, stress accounts for 2/3 of family doctor visits and half the deaths to Americans under the age of 65. And studies by the American Medical Association have also shown stress is a factor in more than 75% of all illness and disease today. What literally happens to your body when you're stressed? Let's say this hungry tiger bounded into the room right now. Your body would definitely respond. Fight or flight. Your leg and arm muscles would mobilize, your blood pressure would go up, and your heart would race. Your body's primary goal would be to run, fight, or defend yourself from the tiger. On the other hand, your blood would be shunted away from the things you wouldn't need to fight the tiger. Your digestion would shut off, your reproductive processes would shut down, and you wouldn't be able to think straight. This is what happens in any stressful situation. I mean, we don't usually have tigers in our lives, but we do have traffic, relationships, politics, work stress. And look around. Think about the most common diseases of our time. Indigestion, anxiety, depression, IBS, erectile dysfunction, high blood pressure. These are just a few of the signs and symptoms of stress. Often when we have stress-related problems, we turn to medication for help. The problem is that often the medical intervention harms us rather than helps us. Over 100,000 people die every year as a result of prescription drugs that were properly prescribed. Between medications and unnecessary procedures and surgeries, hospital-acquired infections, and preventable medical errors, we have an estimated 700,000 deaths annually in the U.S. And these statistics are just the deaths. The number of reported hospitalizations or permanent disabilities that result from properly prescribed medications is over 2 million. And in 2009, the journal Pediatrics reported 600,000 adverse reactions just in children. The bottom line is, if you have a health problem that at its core is stress-related, and you just cover it up with drugs or surgery, it's like putting a smiley face sticker over your check engine light. The amazing thing is that with all our medical advancement and all of the pharmaceuticals available to us, the U.S. is still only ranked 37th in the world for health system performance. We're between Slovenia and Costa Rica. So let's talk about where chiropractic comes in to help us achieve better health without costly and invasive interventions. Here are a few things about chiropractic that most people don't know. Chiropractic is based on 3 basic principles. Principle number 1. Your body is a self-healing and self-regulating organism. What happens when you cut yourself? A complicated process begins immediately, causing inflammatory proteins to come to the injury site, and the body starts to weave together new strands to create a scab and protect the body from infection. We're constantly inhaling germs and viruses and particles from our environment. Most of the time, if our immune response is good, our body automatically prevents those particles from getting into our system and making us sick. These are examples of self-healing. Now, what happens when you exercise? Your heart rate increases so you can get more blood flowing to your muscles as they exert so that they can have more oxygen. And when you stop exercising, your heart rate comes down to normal all on its own. This is called self-regulation. Principle number 2. The brain and nerve system are the master controllers of the body. Chiropractors like to think of our nervous system as our healing system. After all, it's our nervous system that allows us to be self-healing. We call this healing energy innate intelligence. There is an innate or inborn wisdom that runs your body. It turns out your body's intelligent and it has the ability to heal most things that come your way. And the main superhighway for this intelligence is your nervous system, your brain, your spinal cord, and all the nerves that go throughout your entire body. Look at the complex pathways of the nerves that govern all of our muscles, glands, and organs. Our nervous system is one of the major keys to good health, and keeping our nervous system in good order is essential for a good, healthy life. Finally, principle number 3. If there's interference in your nervous system, which we call subluxation, your body cannot function normally and it's no longer fully self-healing and self-regulating. When you have a subluxation, this intelligence is turned down and sometimes turned off. This means a downward spiral of health and the onset of health issues. So when you have a subluxation of the spine or nerve interference, would you call that a back problem or would you call it a health problem? To help put the body and nervous system back in good alignment, chiropractors do adjustments. Chiropractic adjustments target subluxations and progressively bring ease into your nervous system. Through adjustments, we can bring back motion, healthy muscle tissue, and good nerve flow throughout the entire body. This is also why adjustments often lead to a decrease in pain. Every adjustment sends a message to your brain to try and change the pattern of your muscles and spine. Changing a brain pattern is hard work, and it takes time and patience. It's like learning how to play the piano or learning how to write with your opposite hand. Each adjustment works upon the next. It's a series of changes that allow your brain to learn. We do series of adjustments to make the biggest and longest lasting changes. It's important to stick to your adjustment schedule that your doctor laid out for you as best as you possibly can. And if you have to cancel an appointment, try to find a time to make it up in the same week. In addition, following your doctor's recommendations for home care will help you achieve your goals faster and more fully. These recommendations may include exercises and stretching, diet and nutritional counseling, and stress-relieving practices such as meditation, yoga, or deep breathing. At Englander Chiropractic Center, chiropractic is available to everyone, from newborns to people 100 years old or older. We serve pregnant women from their child's conception to birth and beyond. And because of our gentle adjusting techniques, we can see people with more delicate health issues, such as people with osteoporosis or people going through cancer treatment. Everybody's welcome. Our staff is available and happy to answer any questions you may have about your care going forward. You can reach us by phone or by our email, and also check out our website, englanderchiro.com. We look forward to working with you and helping you achieve your healthy goals.